this is Bianca Martinez, and I'm going to be doing our demonstration videos for week 6. I'm going to begin by pulling up our first patient in the MAR. The name is going to be Anna Kendrick, date of birth 4/5/1980, here with the diagnosis of diabetes mellitus, allergies to penicillin and sulfa, and her provider, Dr. Who, has ordered metformin at 500 milligrams PO daily today and now. So now that we put up the patient, we are going to go ahead and go over to the Pyxis. Look for the medication, which metformin is in a tablet form, and we learned in class yesterday that metformin is usually not given in a hospital setting because it can possibly interfere with scans or testing the patient may have to do, such as dyes that they may use for CT scans. But we're going to go ahead and do our second check. It is going to be for Anna Kendrick, date of birth 4/5/1980, here with the diagnosis of diabetes mellitus, allergies to penicillin and sulfa, and Dr. Who has prescribed metformin 500 milligrams PO daily. We are going to make sure the medication is not expired and the expiration date is 10/20/37, so the medication is good. We are now going to head over to our patient's room. Begin by knocking on the door, closing the curtain for privacy, hand hygiene. We are going to introduce ourselves to the patient. Hi Anna, my name is Bianca. I'm going to be your nurse today. I'm here to give you your diabetes medication. Do you have any questions for me? You do? So your provider, Dr. Who, has ordered us to give you metformin at 500 milligrams. It is going to be a tablet that you're going to swallow, and its main job to do is to help regulate your glucose level. So once the patient doesn't have any more questions, we are going to do our third medication check by looking at the medical band. Can you tell me your name and date of birth? Anna Kendrick, date of birth 4/5/1980. We're going to triple check by asking our patient if they have any allergies. Do you have any allergies, Anna? To penicillin and sulfa. Okay, so now that we did our third medication check, and I'm going to ask the patient if she has any swallowing issues. Hi Anna, do you have any problems swallowing? No. Do you mind taking a sip of water from me? Once I make sure the patient has no swallowing issues, I'm going to go ahead and prepare the medication by opening it, putting it in the medicine cup. Okay, now I'm going to go ahead and administer the medication to the patient. Here's your water. Discard the garbage into the trash can. Hand hygiene. Okay, and some signs and symptoms to keep an eye out for. It's common, it possibly may give you diarrhea or upset your stomach, but the one symptom you want to keep an eye out for is if you start to feel any cramping, let us know, because that can be a side effect of the development of lactic acidosis. Do you have any other questions for me? No? I'm going to go ahead and put your call light right here. If you need anything, please don't hesitate to give me a call. So before I leave the patient's room, we're going to go ahead and document that Anna Kendrick, with the date of birth of 4/5/1980, diagnosis of diabetes mellitus, with allergies to penicillin and sulfa, was given metformin 500 milligrams PO daily. I'm now going to move on to our second patient. I'm going to begin by pulling her up in the MAR. It is going to be for Ms. Natalia Romanoff, diagnosed, date of birth 4/20/1975, diagnosis of diabetes mellitus. She has no known drug allergies, and her provider, Dr. Who, has ordered 5 units of regular insulin and 5 units of NPH insulin to be given SQ. So we are now going to go ahead and head over to our Pyxis. With giving this medication is going to be 2 separate insulins. I'm going to put on my gloves to prepare the medication. Before putting on my gloves, I'm going to make sure I'm going to use the same vial for the same ones. Put right here. And the regular insulin is our clear medication, and the NPH is the cloudy insulin. I'm going to go ahead and grab our syringe, grab an alcohol wipe. Before you prepare, you want to make sure both vials' expiration date is up to date. For the regular insulin, the expiration date is 10/23/2023, and for the NPH, it is going to be for 7/20/23. So now that we make sure the medications do not expire, we are going to sanitize the top of the vials, pretending that there is two. So we are going to begin by putting air into the cloudy insulin, which is the NPH. Just a bit of air. And then we're going to put some air into the clear insulin. So now, before I didn't have to, I could have left the syringe in to our first vial. Since after you put air into the cloudy and then clear, you're going to drop 5 units of the clear insulin. Okay. And then you're going to go ahead and go over to the cloudy insulin and draw up your 5 units for that, giving us 10 units total that we will be administering to our patients. Since we're using the syringe, do the one-handed method. And it should print a sticker with both medications on there. Before you leave the medication room, we are going to go ahead and have a second nurse check it. Once they verify that it's at the 10 units, we are going to go ahead and go into our patient's room. We're going to be removing our gloves. So now the second step is going to the patient's room, knocking the door, closing the curtain for privacy. Introduce yourself to the patient. Hi Natalia, my name is Bianca. I'm going to be your nurse today, and I'm here to give you your insulin. So before you give her the insulin, we are going to make sure we have checked her glucose level before. Okay, so now I'm going to go ahead and do my third medication check. Natalia Romanoff, date of birth 4/20/1975, here with a diagnosis of diabetes mellitus, no known drug allergies, and Dr. Who has ordered 5 units of regular insulin and 5 units of NPH insulin. Okay, Natalia, where would you like your shot to be given? In the back of your arm, okay. You're gonna go ahead and alcohol wipe where we give the shot, let it air dry. When it has air dry, we're going to go ahead and say our patient is a bigger patient. So we are going to go in directly at a 90-degree angle. Pinching, going straight down. And my needle actually bent, so that's where it made a mess there. We're going to go ahead and do the one method check. And dispose of it in Sharps container. Removing our gloves, taking them off carefully since we were going to be reusing them. Okay, hand hygiene. Okay, Natalia, I'm going to go ahead and leave you a snack here just in case you feel a little bit lightheaded, and I'll get your glucose working a little bit faster. Do you have any questions for me? Any side effects? You may normal to experience some diarrhea or stomach pains, but if you start to feel more of a strong cramping building up, please don't hesitate to let us know. That way we make sure you're not developing the lactic acidosis. Once they have no more questions, we're going to go ahead and document that Natalia was given her 5 units of regular insulin and NPH insulin for her diagnosis of diabetes mellitus. I'm now going to begin by moving on to our third patient, Mr. Joseph Smith. I'm just going to pull out my other needle, since the first one I probably should be more careful with because the needle bent. Okay, so our third patient is going to be Joseph Smith, pulled up in the MER. Date of birth 6/3/1984, diagnosis of diabetes mellitus. He has no known drug allergies, and Doctor Who has ordered a sliding scale depending on what their AC and HS is. If their blood glucose, they put an amount of different ranges of the amount of units they're going to give depending on what that measurement of their blood glucose is. So we are going to go ahead and, before we pull out the units, we need to know how their blood glucose level is. So I'm going to have another person now. Can you go ahead and check Mr. Joseph Smith blood glucose? He's in room 10. Once they come back, they came up with the result of he has a 230 blood sugar. So with that, looking at our scale that was provided by Doctor Who, we are going to see that he needs 6 units of regular insulin. So we are now going to go ahead and go into our Pyxis, pull out our insulin, and we're going to go ahead and do our second medication check. It's going to be for Joseph Smith, date of birth 6/3/1984, here with the diagnosis of diabetes mellitus, no known drug allergies, and his results from his blood sugar test came back at 230, meaning he needs 6 units of regular insulin given. So I'm going to go ahead and put on my gloves to prepare the medication. Clean the regular insulin, checking the expiration date that the insulin has not expired and it's good to go. I'm going to go ahead and get my syringe, being more careful not to bend this needle. So I'm going to go straight down. After you use the air, pull out the 6 units. Use a needle very carefully, since we are my only good needle. Do a single-handed method of putting safety back on. It will print a little sticker of what the insulin is at, that it was ordered at the 6 units because of his result of his blood sugar glucose. We are going to have a second nurse check the insulin before you leave the medication room. Once they have did the check, I'm going to go ahead and take off my gloves, pretending because you don't want to walk with gloves on in the hospital. Now that the medication is set, I'm going to go ahead and go into our patient's room, close the curtain, hand hygiene, introduce herself to the patient. Hello Joseph, my name is Bianca. I'm going to be your nurse today, and I'm here to give you your insulin. And we're going to ask them if they have any questions. Do you have any questions? So the insulin, like you said, you're used to taking it. It's going to help treat your existing blood sugar. Where do you want your insulin to be given today? So today he's going to pick the belly. Before you give the injection, I'm going to go ahead and do our last medication check for checking the medication band. Joseph Smith, date of birth 6/3/1984, here with the diagnosis of diabetes mellitus, no known drug allergies, and with the results of his blood sugar test that we did right before, he came back at 230, meaning he needs 6 units of insulin. I'm going to go ahead and re-put on my gloves. With an alcohol wipe, clean his belly. Let that air dry. Okay, once it is dry, with him being a bigger patient, we are going to go ahead and squeeze inch, staying away from the belly button. You're going to go in at a 90-degree angle and inject. Pull out with that single thread capping, making sure it does not bend the needle, and then dispose in the sharps container. I don't want to mess them up, so I will put it there. Now I'm going to be taking off my gloves. Hand hygiene. Okay, Joseph, do you have any questions for me? No? And with this, since it is just regular insulin, he does not require any snack, but if they get hungry, you can go ahead and provide it, but he doesn't need one like the previous patient did. I'm going to go ahead and leave your call light right next to you. If you have any questions, don't hesitate to give me a call. Document that Joseph Smith, date of birth 6/3/1984, here with diabetes, was given his 6 units of insulin. Now moving on to our fourth patient, it is going to be Sheldon Cooper that we pulled up in the MAR. Date of birth 8/14/1990, here with the diagnosis of diabetes. He has an allergy to latex, and Doctor Who has ordered 10 units of Lantus to be given subcutaneous. So we are going to go ahead and go into our Pyxis. Since we're going to be preparing insulin, I'm going to go ahead and put on my gloves. We're going to get in our insulin vial. Check to make sure that expiration date it is still good, and it expires 1/20/23, which the medication is still okay to give. So we're going to go ahead and just draw up 10 units of Lantus while putting in a little bit of gush of air, going directly down, being careful not to bend the needle, and pulling out 10 units. With a single method hand, capping it being careful not to bend this needle. Okay, putting the vial back, and then it should print out like the other diabetes medication, the sticker of it being 10 units given here. Before you leave the medication room, we are going to have another nurse check it, which would be at the same time our second medication check for, I'm going to take off my gloves, for Sheldon Cooper, date of birth 18/14/1990, here with the diagnosis of diabetes mellitus, and Dr. Who has ordered 10 units of Lantus. Once the second nurse did the medication, we are going to go ahead and go into the patient's room, no gloves on, knock on the door, close the curtain for privacy, hand hygiene, introduce ourselves to the patient. Hi Sheldon, my name is Bianca. I'm going to be giving you your Lantus medication for your diabetes. Do you have any questions for me? No? Okay. Can you go ahead and state your name and date of birth for me? Sheldon Cooper, date of birth 8/14/1990, and I see he's here for diabetes. Do you have any allergies? You do? To latex? Okay. So we are going to go ahead and ask them where they would like their shot. In the back of the arm. Okay. So now we're going to go ahead and get an alcohol prep. Wiping the area clean. Letting it air dry. Where would you like your injection, Sheldon? In the back of the arm. Since he is a smaller person, we are going to pinch very slightly, going in at a 45-degree angle instead of 90. Check. So you're going to very carefully cap it, single-handed method of use, putting it into the sharps container once we're done. We are going to take off our gloves. Hand hygiene. Okay, Sheldon, do you have any questions for me? With Sheldon being previous diabetic, they might not have any more questions. If you need any help, I'm going to go ahead and leave this call light right next to you. If you don't hesitate to ring it if you need anything. Before you leave, you want to make sure you document for Sheldon Cooper, here for date of birth 8/14/1990, here for diabetes mellitus, and Doctor Who has ordered lenses at 10 units. So with our next patient, it is going to be for Gene Belcher, pulled up in the MAR, date of birth 12/3/2004, here for a diagnosis of asthma. He has no known drug allergies, and Doctor Who has ordered albuterol inhaler using a spacer now every 4 hours. So we are going to go ahead and go into our Pyxis, pull up the medication, which we're going to check the date of birth for the albuterol, and it expires 2/2023. The medication's still being good. So this is going to be my makeshift inhaler with my spacer. Now that we have the medication, the inhaler in hand, we're going to go ahead and go into our patient's room. Begin by knocking on the door. Oh, before you go to your patient's room, doing your second check. Gene Belcher, date of birth 12/3/2004, here with the diagnosis of asthma, no known drug allergies, and Doctor Who has ordered albuterol inhaler using a spacer every 4 hours. So now we can go to the patient and begin by knocking on the door, closing the curtain for privacy. Hi Gene, my name is Bianca. I'm going to be your nurse today, and I'm here to give you your albuterol inhaler using a spacer to help you expand your lungs and help you breathe easier. Do you have any questions about the medication? So the albuterol is used as a bronchodilator, and it's help prevent airway obstruction. One thing we are going to look for is you should receive immediate relief, and the medication is only to be used as directed. We're going to do our third medication check before we give him some. For Gene Belcher, date of birth 12/3/2004, here with the diagnosis of asthma, and Doctor Who has ordered albuterol inhaler using a spacer now every 4 hours, and he has no known drug allergies. And just to be safe, I would put my gloves on because the medication could touch their mouth. Now that we did our third check using the spacer and our makeshift inhaler, we're going to put it close to their mouth, spray, have them inhale. Once it's done, put the medication down, take off their gloves. Do you have any questions for me, Gene? How is that feeling? Is it helping you? Makes a difference, huh? We're going to do some hand hygiene. Once we ask the patient if they have no questions, it'll be okay. We make sure we give them the collate, putting it next to them so it's in hand's reach. Document that Gene Belcher was giving his asthma medication, date of birth 12/3/2004, and he was giving albuterol inhaler using a spacer every 4 hours. So we talked about in class yesterday that not to do Tina Belcher using the albuterol, the nebulizer, since we don't have the equipment. You're still going to do your 3 medication checks, preparing it, and after you give it to your patient, you want to make sure you rinse out all the equipment with warm water and just letting it air dry. So I'm now going to go ahead and just do our final patient, pulling up in the MAR. It is going to be Linda Belcher, date of birth 9/4/1972. Here with the diagnosis of atrial fibrillation. She has no known drug allergies. And Doctor Who has ordered Coumadin milligram PL for her atrial fibrillation. We're going to go ahead and go into our Pyxis. Pull up Coumadin. Checking our expiration date to make sure it is still good, which it is. For our second check, it is Linda Belcher, 9/4/1972. Here for atrial fibrillation. No known drug allergies. Here for Doctor Who prescribed Coumadin 5 milligrams PL. Once we did our second check, we're going to go ahead and go into our patient's room. Begin by knocking on the door, closing the curtain, hand hygiene, introduce yourself to the patient. Hi Linda, my name is Bianca. I'm going to go ahead and be your nurse today, and I'm here to give you your Coumadin medication. It is important to monitor the patient's INR in their lab test to make sure it is not too high. So the Coumadin is basically to help you, since your heart is beating a little faster, to help prevent blood clots from forming. And we're going to be monitoring you very closely with you having 2 IVs to make sure you're not having excess bleeding. But it's just, like I said, to help prevent any formation of blood clots. Do you have any questions? They don't? We're going to go ahead and do our third medication check. Hi Linda, can you state your name and date of birth? Linda Belcher, date of birth 9/4/1972, no known drug allergies. Do you have any issues swallowing? Have them drink some water. Make sure swallowing is good. Once it is, we're going to go ahead and administer the medication. Have them drink a sip of water. Throw the garbage into the can. Hand hygiene. And like I mentioned before, Linda, just make sure we're going to be checking your IV sites, anywhere you may have been blood drawn. Make sure you're not having excess bleeding. I would try using an electric toothbrush, or if you shave, an electric one. That way you don't cut yourself and you prevent that excess bleeding from occurring. But if we see that you have it, we're going to use our antidote, which is the vitamin K. Once they have no more questions, you put the collie right next to them. If you have any questions, please don't hesitate to ask. Document that Miss Linda Belcher was given her Coumadin at 5 milligrams PO daily. And hand hygiene before you do the documentation.